Hello, health is wealth. You are what you eat. Thank you for joining me back. Today we are going to talk about mind over matter, matter being your weight and your wellness. Let's talk about some basics. First is conscious mind, which is 5% of the time we use our conscious mind. It holds all our desires, wishes, and aspirations, and it helps us deal with our past, present, and future. Next is your subconscious mind, which we are in 95% of the time, but that deals with now, this minute. And also, this is purely a response, of stimulus response. So we see the food, we consume it, and we do that 95% of the time. There is no known reasoning to do so. Next is dopamine. Dopamine is a chemical which helps us feel, it's a pleasure hormone, it's a pleasure chemical. And studies have now proven that overweight and obese clients or patients have low levels of dopamine, which causes them to increase their stimulus in form of food intake to satisfy themselves or have increased satiety. So that is the dopamine. Next is your brain has a crave spot. The crave spot includes an area of the brain which gets stimulated every time we have our desires, addictions. And the larger the crave spot, the more addicted we get. And again, we see this happening in people who are addicted to food as a stimulus. Next is, so let's talk about some of the mental disorders. Today I'm going to talk about and mention about different types of mental disorders. And in my next video, we will talk about the management or treatment. So the main three types of mental disorders, number one is your eating disorders. The commonest one is binge eating disorder. In binge eating disorder, you do it almost 2 to 3 times a week for up to 6 months. You eat excessive amounts of food in excess of until it makes you feel good. It's not related to until you get full, but it makes you feel good. And this is very common, up to 3 to 4% of adults. Next is your night eating syndrome, in which you consume your 50% of your calories towards the evening or even after 5 or 8 o'clock. So when you go to sleep with a full stomach, you increase your insulin levels, and that causes your fat deposition. So that is your night eating syndrome. Next is nocturnal sleeping eating disorder, which is actually not an eating disorder, but it's worth mentioning because it's a sleep disorder in which people will consume excessive amounts of uncommon food and unusual food, and even sometimes non-food items they would consume at night. There have been many people who would walk up at night and go to the fridge and consume food. They do not even remember doing that. That is your nocturnal sleeping disorder. Two other disorders which are actually eating disorder worth mentioning, but they do not cause weight gain, they cause weight loss. Nevertheless, they are very common. They are common with young adults and need treatment. They are anorexia nervosa, and in which again there is a fear of gaining weight, causes fear of eating. Next is your bulimia nervosa, in which you eat and you binge eat and then you purge in order to let go your food. That's again a mental disorder worth mentioning, and we need to treat. Next is your personality disorders. Personality disorder. In a personality disorder situation, one has no insight into their stimuluses, and they do not want to believe what they see around them. So it's a conscious decision to not acknowledge their stimulus. And then personality disorder is again very difficult to treat. However, it exists. Next is your mood disorders. The mood disorders, of course, you have your major depressive disorders and the anxiety disorders. So these are broadly your mental disorders, and all of these are associated with weight gain, obesity, and in some conditions weight loss. So in my next video, I'm going to discuss about each mental disorder, how do we treat them, how do we deal with them. And until then, stay tuned, be beautiful, be you.